Hello and welcome to this lecture of novel coronavirus, in which we will talk about the testing phase to identify presence of COVID-19. So firstly, we ask, what is a diagnostic testing? A diagnostic test for an infectious disease can be used to demonstrate the presence or absence of infection, or to detect evidence of a previous infection. Demonstration of the presence of the bacteria or virus causing the infection is important for effective patient management and for guiding treatment of infection and informing any public health measures required. In a pandemic situation such as COVID-19, diagnostic tests are either performed to detect the virus SARS-CoV-2 or to determine the antibodies made in response to the virus. So, these tests are a highly sensitive and specific molecular test. For molecular testing, viral genetic material is usually detected for a few days after the onset of symptoms, but in the case of COVID-19 can also be detected 1 to 2 days before. These tests take 1 to 4 hours to perform in a laboratory. They only require a few minutes of hands-on time and results are available in 5 to 45 minutes. Second, an antigen test that are designed to detect a specific protein in the virus that elicits the body's immune response. In the case of COVID-19, it is the spike glycoprotein present on the surface of the coronavirus that facilitates its entry into the human cell. The advantage of using this test is that it reduces the burden of relying on just RT-PCR test, which we are going to see next, to identify COVID-19 patients. These tests are immunoassays that can be performed in a laboratory or as simple rapid tests that can be performed by non-laboratory personnel, with results being available in about 10 to 15 minutes. They are less sensitive than molecular tests but usually allows a longer window for viral detection. Third, a serology test, also known as antibody test, are used to detect antibodies that patients develop in response to infection. Antibodies are naturally produced by the body's immune system to fight off infections. These tests can be used to assess the true extent of an outbreak and inform prevention and control strategies. Serological tests are available as high throughput immunoassays performed in a laboratory in 2 to 4 hours. What is a RT-PCR? RT-PCR stands for reverse transcriptase polymerase chain reaction. RT-PCR test is a real-time test for the qualitative detection of nucleic acid from SARS-CoV-2. It is the most commonly used test for the detection of COVID-19 in many countries. The RT-PCR test starts with a simple swab taken from inside a person's throat or nose. Coronaviruses have RNA or ribonucleic acid as their genetic material. However, swabs from patients yield only a tiny quantity of RNA, which is obviously not adequate for the testing process. So, PCR, a process that repeatedly copies and amplifies the specific genetic fragments of the virus, ensuring that there is enough of a sample to conduct the analysis, is then used. The time duration for this RT-PCR testing process is around 4 to 8 hours, but results may take up to a day to arrive because of the time taken to transport samples to labs. The scale of the testing planned or being implemented in many countries is substantial because there is a huge gap between demand and supply for these testing kits. Increasing capacity for the testing requires new laboratories and more skilled staff, and for smooth logistics operation, and for all the personal protective equipments PPEs. Also, antibody tests are very high in demand to investigate the outbreak and expansion of COVID-19. So, these serological tests need further examination. That's it for this lecture. Let's meet in the next one. Till then, remember, stay home, stay safe. Thank you.